Oral medication to treat anemia. Anemia is a frequent and sometimes devastating CKD symptom, CKD. Anemia occurs when the kidneys are injured, decreasing the body's ability to produce erythropoietin, EPO. Enzyme-stimulating agents, ESAs, are being used to treat anemia in people with chronic kidney disease, CKD. HIF PH inhibitors are a novel kind of medicine that may be used orally to treat anemia, according to researchers at Brigham and Women's Hospital. The ASCENT studies evaluated the oral medication's safety and effectiveness to conventional therapy in individuals with CKD on dialysis and those not on dialysis. William G. Kellin Jr., MD, of the Brigham and Dana-Farber Cancer Institute, and co-workers discovered how cells detect and adapt to oxygen supply. The 2019 Nobel Prize in Physiology or Medicine honored these discoveries. HIF PH inhibitors work by stabilizing proteins called hypoxia-inducible factors, encouraging the body to manufacture its own EPO and boosting iron mobilization to bone marrow. ESAs have long been linked to increased risk of stroke, heart attack, vascular access thrombosis, tumor development, and mortality. The HIF PH inhibitor's ability to raise hemoglobin was assessed in the Phase 3 ASCENT studies. Throughout the trials, an impartial committee assessed MACE. Hemoglobin levels climbed 280.02 grams per deciliter with daprodustat and 100.02 grams per deciliter with ESA in the trial's 2,964 dialysis patients, satisfying the trial's goal. MACE occurred in 374 of 1,487 individuals, 25.2%, and 394 of 1,477, 26.7%, in the daprodustat and ESA groups, respectively. The researchers published data from 3,872 non-dialysis patients. Following daprodustat treatment, hemoglobin levels climbed to 740.02 grams/dl, the trial's endpoint, and 660.02 grams/dl, ESA. MACE occurred in 378 of 1,937 people in the daprodustat group and 371 of 1,935 in the ESA group, respectively, satisfying the trial's goal. The open-label design of the study permitted participants to know their treatment assignment, possibly skewing adverse event reporting, the authors warn. While the experiment lasted many years, HIF PH inhibitors may have carcinogenic or other long-term consequences that need longer follow-up to discover. As these studies only looked at darbepoetin and epoetin, the results may not apply to other ESAs. The study's size was one of its assets, since it was bigger than earlier HIF PH inhibitor trials with more strong findings.